Everyone, welcome to this UNICEF briefing of Tuesday, the 17th of August. Bonjour à tous et bonjour à toutes. Bienvenue à ce briefing du 17 août. We have quite a lot on our plate this morning with the one single topic of Afghanistan, of course. All eyes are on what's happening over there. So we will hear from OHCHR, UNHCR, WHO, and UNICEF, and then we'll take some questions. But just to start it off, you will have received the statement of the Secretary-General that we issued yesterday, his remarks to the Security Council, where he appealed to Council members and to the international community as a whole to stand together, to work and act together, and to use all tools at their disposal to suppress the global terrorist threat in Afghanistan, and to guarantee that basic human rights will be respected. He called upon the Taliban and all parties to respect and protect international humanitarian law and the rights and freedoms of all persons. Mr. Guterres said he is particularly concerned by accounts of mounting human rights violations against the women and girls of Afghanistan who fear the return of the darkest days of the history of their country. The Secretary-General noted that the UN is committed to supporting Afghans and that we continue to have staff and offices in areas that have come under Taliban control. He said the UN presence will adapt to the security situation, but above all, we will stay and deliver in support of the Afghan people in their hour of need. Secretary-General noted that the following days will be pivotal and that the world is watching. He stressed that we cannot and must not abandon the people of Afghanistan. And to start us off, I will give the floor to Rupert Colville from the Office of the High Commissioner for Human Rights for a statement on this issue. Good morning, Rupert.
Good morning. The desperate scenes at Kabul airport yesterday underlined the gravity of the situation after the Taliban seized all the major population centers in Afghanistan. Fortunately, the capital and the other last major cities to be captured, such as Jalalabad and Mazar-e-Sharif, were not subjected to prolonged fighting, bloodshed, or destruction. However, the fear instilled in a significant proportion of the population is profound, and given past history, thoroughly understandable. Taliban spokespeople have issued a number of statements in recent days, including pledging an amnesty for those who worked for the previous government. They've also pledged to be inclusive. They've said women can work and girls can go to school. Such promises will need to be honored. And for the time being, again, understandably, given the past history, these declarations have been greeted with some skepticism. Nevertheless, the promises have been made, and whether or not they are honored or broken will be closely scrutinized. As the Secretary-General said in his statement to the Security Council yesterday, all parties, including the Taliban, have an obligation to protect civilians and to uphold human rights. They must respect and protect both international humanitarian law and international human rights law. As the High Commissioner noted a week ago, and the Secretary-General also pointed out yesterday, there have been chilling reports of human rights abuses and of restrictions on the rights of individuals, especially women and girls, in some parts of the country captured over the past few weeks. Such reports continue to be received. Unfortunately, for the time being, the flow of information has been considerably disrupted, and we've not been in a position to verify the most recent allegations. There have been many hard-won advances in human rights over the past 2 decades. The rights of all Afghans must be defended. We're particularly concerned about the safety of the thousands of Afghans who have been working to promote human rights across the country and who have helped improve the lives of millions. We call on the international community to extend all possible support to those who may be at imminent risk, and we call on the Taliban to demonstrate through their actions, not just their words, that the fears for the safety of so many people from so many different walks of life are addressed. Thank you.
Thank you very much, Rupert. We're going to go now to Shabia Mantoo from the Refugee Agency, who also has a statement.
Good morning, everyone. The UN Refugee Agency has released a non-return advisory for Afghanistan, calling for a bar on forced returns of Afghan nationals, including asylum seekers who have had their claims rejected. In the wake of the rapid deterioration in the security and human rights situation in large parts of the country and the unfolding humanitarian emergency, UNHCR calls on states to halt forcible returns of Afghan nationals who have previously been determined to not be in need of international protection. UNHCR remains concerned about the risk of human rights violations against civilians in this evolving context, including for women and girls, those perceived to have a current or past association with the Afghan government, international organizations, or with international military forces. Since the beginning of the year, more than 550,000 Afghans have been internally displaced as a result of conflict and insecurity. While civilians have so far fled only sporadically in fewer numbers to countries neighboring Afghanistan, the situation continues to evolve rapidly. As the situation is fluid and uncertain, UNHCR continues to call for access to territory to allow civilians fleeing Afghanistan and to ensure respect for the principle of non-refoulement at all times, which is the prohibition on returning people to situations of danger. States have a legal and moral responsibility to allow those fleeing Afghanistan to seek safety and to not forcibly return refugees. UNHCR has welcomed the recent actions taken by some states to temporarily halt deportations of failed asylum seekers. UNHCR's advisory against forced returns to Afghanistan remains in effect until security, rule of law, and the human rights conditions improve enough in the country to allow for safe and dignified returns. Thank you.
Thank you very much, Shabia. Before we go to UNICEF, we're going to hear briefly from Tarik Jašarević from the World Health Organization, who also has a statement for you on the situation in Afghanistan. Tarik joins us online, and
Thank you, Rael. I will be very brief. I will send more in the notes, but just to say that obviously the ongoing conflict is having a heavy toll on already fragile health system in Afghanistan that has been facing shortage of essential medical supplies and equipment in the middle of the COVID-19 pandemic. Needs assessment and service delivery by mobile health teams is on hold for past 24 hours, and that's due to insecurity and unpredictable situation in Kabul. Disruption to health services can have a dire effects in the future. Disruption at the airport is also delaying urgently needed essential health supplies. Crowding at health facilities and IDP camps due to rising conflict in the country will limit implementation on infection prevention protocols, increasing the risk of COVID-19 transmission and other disease outbreaks. The COVID-19 vaccination and other essential vaccination programs have also been significantly affected due to the fighting. And just to remind you that Afghanistan remains one of 2 polio endemic countries of the world, and any delays and disruption to polio campaigns will directly jeopardize the health of Afghan children. For WHO, the priority is really to maintain access to health services and to have health workers and health facilities respected and protected. More in a note that I will send.
Very good. Thank you very much, Tarik. Now, moving from Geneva and directly to Kabul, we're going to hear from Mustapha Ben Messaoud, who is the Chief of Field Operations and Emergency at UNICEF. He is our guest this morning. James Elder, the spokesperson for UNICEF, also joins. James, do you want to say anything before we go directly to Mr. Ben Messaoud?
Good morning, everyone. No, it's very good. Look, just very glad that Mustapha can join. As everyone knows, it's 18-hour days there, and it's field operations. His role is logistics and program delivery, but he's been very good at engaging press on the situation. So, Mustapha, over to you. Thank you.
Thank you very much. Over the past 2 weeks, I have been in Kandahar and I have my colleagues in touch with me from Herat, Jalalabad, and Mazar. And while in Kandahar, I've seen direct impact of this recent flare infighting. And that direct impact is severely malnourished children I've seen injured in such a way that it's difficult to describe young children as young as 10 months. The situation here in Kabul is improving, but we've seen and we went to IDP camp. We've started the work there, mobile health team, but as mentioned by the colleague from WHO, it stopped over the last few days. And there is a great need there that we need to attend to. This last flare in conflict has taken a greater toll on the women and children of Afghanistan. And since the start of the year, 550 children have been killed and maimed by this conflict. And you've seen this in the 5th report of the UN Secretary-General on Children and Armed Conflict in Afghanistan. Child casualties for the first half of this year constituted the highest number of children killed and maimed for this period ever recorded by the UN in Afghanistan. Afghanistan is a very difficult place to live for children, and it's getting worse, right? As we speak, our prediction for 2021 are 1 child out of 2 will be severely malnourished. There are 18 million Afghans that are in need of humanitarian assistance. Half of them are children. Despite those challenges, the UNICEF and partners across our 11 field offices in Afghanistan, we've stayed open and we are delivering in most of our places. And we are committed to remain open and to deliver. As I speak right now, we have our Director of Operation and Emergency, Manuel Fontaine, and our Regional Director that landed the last Sunday here in Afghanistan. And the reason they're here is because we're calling for an immediate and embedded access so we can get our people in the field, not in our zonal offices, but in the hard-to-reach area, so we can deliver much needed support to the Afghan population, and especially women and children that are paying the heaviest price in this last round of conflict. Thank you.
Thank you very much, Mr. Ben Messaoud, Chief of Field Operations and Emergency at UNICEF, talking to us from Kabul. We are going to take some questions now. We will go to Catherine Fiancan, who joins us online first.
Yes, good morning, Real. Good morning to all. Thank you for this briefing on Afghanistan. I have 2 questions. One is directed to Mr. Mustapha Ben Messaoud, who is in Kabul. You just mentioned that you have 11 field offices in Afghanistan. I suppose they all open. Who is working there? Are there Afghan people that are working in those offices? And could you tell us if those people have any risk, as we know that Taliban often consider Afghan people working with foreigners are traitors? And to Rupert, good morning, Rupert. What does the High Commissioner advise international community to do in order to save the 1,000 people that worked during the last 20 years with the different international community, but not only high-level people. I'm thinking to drivers, cooks, people, very, I would say, normal people that had jobs over there. And maybe Shabia can tell us more on that too. Thank you so much.
Mr. Ben Messaoud, would you like to go first?
Thank you, and thank you, Catherine, for the question. Let me correct myself or precise myself. We have 13 offices across the country. I've mentioned 11 because those that are fully functional. Now, in those zonal offices, we have international colleagues that are working there, and we have our national colleagues. In terms of perception from the Taliban, we've been here for 65 years, and this morning in actually 2 of our zonal offices, we were in meetings with newly appointed NGO commissioner for the Taliban. We've had discussion with them, ongoing discussion, and we are quite optimistic based on those discussions, but remain to be seen. We have not a single issue with the Taliban in those field offices. Thank you.
Thank you for that. Rupert, to you.
Thanks, Catherine, for the question. I think basically for the safety of civilians, and particularly at-risk groups, is obviously of paramount importance right now. So I think essentially 2 messages on that. Member states need to use their influence with the Taliban, bilaterally and multilaterally, to protect civilian lives. States have a duty to use any leverage they have to de-escalate the situation and install calm and ensure protection of at-risk groups. As I said earlier, the Taliban have made a number of statements that on the surface are reassuring, but as I said, actions speak deeper than words, and it's very early now, it's very fluid. It's very hard to say what is happening exactly, but it's also extremely important that states, as Shabia mentioned, ensure the protection of Afghan refugees arriving on their territories. And given the involvement of so many states in Afghanistan over the past 2 decades, and in many cases longer than that, we hope they will step up to not only enable people at risk to leave the country safely and live elsewhere, but also to provide the aid that is so desperately needed for the hundreds of thousands of displaced people and the millions who are in need of aid across the country. And that's going to be very important over the months to come.
Shabia, did you want to add?
Just to reiterate what my colleagues have expressed to you, Catherine, thank you for the question. But obviously, we reiterate the calls for the protection of civilians, for human rights, and to ensure that those civilians who may be at risk within the country, that they are able to seek safety, and also including in neighbouring countries if that is needed. So we do continue to call on countries neighbouring Afghanistan to keep their borders open in light of the intensifying crisis, and to ensure the safety and protection of those that might be at risk. Thank you.
Thanks, Shabia. We have other questions online, but we'll go to James Keaton here in the room first.
Good morning, everyone. Rupert, if you could, I just have a couple of questions, one for Rupert and one for Mr. Ben Messaoud. Rupert, you mentioned that there are some unconfirmed reports. Yesterday, there was a statement from the independent experts that are working with the Human Rights Office who spoke about 1,000 deaths, civilian deaths over the last month alone. I just wanted to know, is that the figure that you are also quoting, or is that where would that figure come from? Do you have any sort of figures in terms of the numbers of civilian deaths over the last month? And could you also tell us about, you mentioned unconfirmed reports and there's a lack of information, but in terms of atrocities, we've been hearing reports, for example, of women or girls who have open-toed shoes that are getting disciplined. We have hearing reports of people, unconfirmed reports, I should add, that talk about, maybe soldiers who have been dealt with in a violent manner. Do you have anything along those lines? And finally, just for you, I mean, you mentioned that there's a lack of information. I mean, there have been untold thousands of aid workers in Afghanistan over the last 20 years. What do you attribute the lack of information to? Is there a lack of, are people themselves feeling squelched? They can't speak? Is there a physical drop in the communication lines? Do you not have people, are there not people who are credible in the field? I mean, how do you explain that, given the presence of UN institutions and aid agencies in that country for so long, that you're not able to get any credible information? And Mr. Ben Messaoud, if I could just ask you about if you could identify the newly appointed NGO commissioner for the Taliban, that struck me as very interesting. And how credible do you believe that person is, particularly with regard to individual Taliban in the field in specific towns and cities and villages, whether or not that commissioner will have wherewithal. And if you could you also mentioned very quickly, you mentioned the number of deaths of children who have been killed or maimed since the beginning of the year. How many of those have happened in the last month, or even in the last 2 weeks, since 2 weeks or so since the Taliban has been taking over cities across the country? Thank you.
Do you want to start, Rupert, and then we'll come to you, Mr. Ben Messaoud?
On civilian casualties, well, again, that's one of the issues. We can't really update right now because of the fluidity of the situation. But I would draw your attention to the press release that went out exactly 1 week ago on the 10th of August. That did have some figures. We knew of at least 183 civilians killed since the 9th of July in just four cities alone, and over 1,000 injured. But full up-to-date civilian casualties is itself a casualty of the current upheaval that's taking place. Again, in that press release, we addressed quite a number of the violations that we were aware of at that time, and which we had been able to at least partly verify. As I said, since then, things changed so rapidly across the country. It's been very hard to keep up and to keep track of everything that's been going on, and particularly to verify properly allegations. We obviously have to be careful that we don't just assume that an allegation or report is correct. You ask about why is the lack of information? Well, I think that's very clear. This is a massive upheaval across the whole country. And there's a great deal of fear, especially in the major cities such as Mazar-i-Sharif and Kabul, Herat. So it's not at all surprising that leads to difficulties in gathering information, and particularly in going out to verify specific incidents, and that which is what we would normally do, and that's much more complicated at the moment. So it's extremely fluid, and hopefully that is temporary, and we will get more concrete information, sooner rather than later.
Mr. Ben Messaoud.
Thank you, James, for the question. On the interaction with the Taliban, because our offices remained open, once the cities were taken, the Taliban came to our offices and identified themselves. So the first interaction was with the military wing or military commanders of the Taliban, but within roughly 2 to 3 days, so they appointed NGO commissioners, and now we are interacting with them. And in Herat yesterday, they also appointed a health director who actually had a meeting with the humanitarian, and we're slightly optimistic there because he told women health worker to report to their offices and duty. So slightly optimistic on that front. In terms of number of children killed and maimed within the last 2 months, the process, and we need to verify and cross-check the numbers, but the number was quite high and probably close to 100 for children killed, and close to more than 300 for children maimed for the month of, I'll say July, and that does not include August. We are with the mission here verifying those numbers, and hopefully we should be able to communicate through the normal statement. Thank you.
Thank you very much, Mr. Ben Messaoud. We have several people online also wishing to ask questions, so we'll go to Gabriela. Could I ask you, yeah, we'll come back to you, James. Could I ask each journalist to maybe limit their questions to 2 brief questions so we can go through the list, and then we'll try to come back if we have time. So Gabriela, please, you have the floor.
Yes, thank you very much, Renal. Hi, hello. Well, I have 1 short question and 2 large questions. In total, how many UN personnel are in Afghanistan? How many women and men? For the refugee agency, I would like to know what is the situation of the Afghan soldiers who fled the country. How many are they? Do you have an estimate? And then I have seen the images, many young men fleeing. But what about the women and girls who want to leave the country? Shouldn't there be a plan to help them first, given the danger they are in? And is there any hope in the Security Council? Sorry.
Yeah, thank you, Gabriela. That's 3 questions, I think. So on the first one, on the number of UN staff in Afghanistan, currently, I mean, overall, there are about more than 700 UN international staff that are assigned to Afghanistan. There are currently about 300 in country. The rest have been teleworking, as I said previously, because of COVID. Because of the COVID pandemic, they had been teleworking for some time. And in addition to those, there are about 3,000 international staff working for the UN. I'm sorry, national, 3,000 national staff working for the UN. Thank you, Rupert. And then you had questions for, was it Shabia? Shabia, maybe you want to take that.
Thank you, Gabriela, for your questions. On the issue and the broader issue of outflows, the answer is we just don't have comprehensive numbers on the people that are crossing borders, so that are going across to neighbouring countries. That information isn't really there, so I can't give you an answer. We did report a fortnight ago that we had seen about 200 people cross over to Iran, but that was at that time. In general, the numbers of people crossing the border are still very, very limited and much fewer than those that are actually displaced within the country. And you talk about women and girls and children, and this is exactly what we have been saying. I came here last week and we were very alarmed because out of the hundreds of thousands of people that have been displaced, we have now 550,000 people displaced within the country. So they're still within Afghanistan. In recent weeks, the majority of those have fled in recent weeks, and 80% of those that are newly displaced are women and children. So they are fleeing. I can't comment, obviously, on the reports and the images. We're all seeing what's happening. It's an evolving situation. But this is a dire humanitarian situation if you have that many numbers, that a big proportion of those that are fleeing that have acute humanitarian needs, they are women and children. Over.
Thank you, Shabia. Let's take a question from Emma Farge from Reuters. Emma,
yes. Can you hear me okay?
Yes, go ahead.
Okay. I was wondering if there is, if you give us an update on getting people out of the country, Shabia or anyone. What is the latest on creating humanitarian corridors, and what is the process for getting people out who risk these reprisals, the people that Rupert referred to, who had worked in human rights, but also others who have worked with the US. How many do you think you can get out? What is the latest on that? Thank you.
Shabia, do you want to take that?
Thanks, Emma, for your question. Look, as I mentioned for now, and I keep on emphasizing it just because the fact is that we are seeing most of the displacement inside the country. We have seen plans by some countries to evacuate people that have been working or affiliated with them, but this is a direct program with those countries and those governments concerned. We're not a part of those arrangements. Within Afghanistan, we're responding to rising displacement and humanitarian needs in the country and outside in neighboring countries where you have refugees, because people become refugees when they cross international borders. We have been there for decades in Afghanistan, Iran, other countries responding to those needs. But within the country, we are aware that there are people with protection needs, and that's why we issued this non-return advisory today for governments that are dealing with asylum claims, dealing with rejected asylum seekers or failed asylum claims, to really raise the alarm of the risks that people will face if they go back. And so with that in mind, within the country, we are referring people who may be at risk to human rights organizations, and also just working with civil society there as well. And we're also referring those that are seeking or have interest in these programs to reach out to them and consult them on opportunities for departure. But it's very important just to make that distinction of our involvement. Over.
Very good. Let's continue now with Peter Kenny. Peter?
Thanks for taking my question. This is to Rupert. Yesterday, the special rapporteurs put out a very strongly worded statement in which they said it was unacceptable. It was a message addressed to the Security Council, and when they said it was unacceptable to stay on the sidelines when a UN Security Council listed terrorist group was overrunning Afghanistan. I mean, I'm just wondering, is this the first time that the UN has had to deal with groups in such a situation? Thank you.
No, I mean, the Taliban themselves overran most of Afghanistan in the mid-1990s. In fact, I went there. I was in Kabul just 1 month after they captured it in the autumn of 1996. So even in Afghanistan itself, it's not the first time by any means. So obviously the special rapporteurs, who are, I would stress, are independent, are saying what they believe needs to be said. I think we all pursue the same end goal, which is to protect civilians and ensure that they enjoy their rights as much as possible. So their statement yesterday is obviously their way, best way they can do that.
Very good. Nick Cummings-Bruce from the New York Times. Nick?
Yeah, thank you. Good morning. I have a question for Mr. Messaoud, please. I was interested in your reference to the meeting with the NGO commissioner this morning. Was this a bilateral meeting between UNICEF and this commissioner, or was this a multilateral one with a lot of different humanitarian organizations participating? And did it cover substantial issues, or was it just a kind of hello and getting to know you kind of meeting? And when you look at the interaction you've had with this guy, and perhaps through your offices in Herat and Kandahar and some of the northern cities, do you have a sense that there is a coherent Taliban approach to dealing with humanitarian issues being formulated and proactively developed? Thank you.
Thank you, Nick. We've had interaction with them. The first interaction that we had with them was were bilateral discussion with them, because in some of the places only UNICEF is open. So that's the first entry point. But we also had meetings with humanitarian partners. The messages or the stand of the Taliban is more or less the same, but we've seen small differences, especially in terms of girls' education. There are part of the country where they told us that they're waiting for guidance from their leadership, religious and political. And in other places, they actually said that they wanna see girls' education and school up and running. We've raised question because, you know, as you may guess, you know, half our staff, if not more, are composed of female Afghan colleagues and international, and especially for the female Afghan colleagues. Here again, we've had mixed measured answers from them, but let's say that we are cautiously optimistic on moving forward.
Thank you very much, Mr. Ben Messaoud. Catherine, I see your hand, but I would like to give others also an opportunity to ask a question, so we'll come back to you. Let's give the floor to Isabelle Sacco from EFE.
Yes, good morning. Thank you, Real. My question is to Mr. Messaoud also is, I would like to have, I was interested by this also meeting that you had or UNICEF representative had with the health director, the Taliban health director, and if he explained or how do they see the access of women and girls to health services and the opportunity that women will have to work on health services also. And if you have some of this interaction also with Taliban education representative in this sector, to have, you mentioned already that you don't have a coherent answer or reply on access to women and girls to education, but did you have already meetings in Kabul or anywhere, somewhere else with Taliban representative in the education sector? And if yes, what did they say? Thank you.
Thank you very much. And let me maybe start, Isabel, on with your second question. So we've had, and we're having interaction almost on a daily basis with the authorities or the newly appointed authorities at the zonal offices. And the reason why I'm saying we are cautiously optimistic is we're still waiting to have a line of communication with a leadership that will emerge here in Kabul, so we can have, you know, a message that we can then try to engage on at Kabul and at the field level. In terms of the interaction that we had with the new director for health in Herat, as I mentioned earlier, the meeting that they had with their female health worker was that they should be reporting to their desk as soon as possible, and that there should be no issue for them carrying on their work. Now, that's a message that we've heard from the health sector, and I think we're quite optimistic that for the health sector, it's going to be smooth. In terms of education, maybe you know, but in December, UNICEF signed a working arrangement with the Taliban about opening, you know, community-based schools in the remote area, accessible to boys and girls. And that working paper was signed with the Taliban, and they're presumed that are the same Taliban that are now in town, in Kandahar and Kabul. So I presume that, you know, their stand is still the same, but is going to be put to the test in the next days or weeks to come. Thank you.
Thank you very much. Let's go to Nina Larson from AFP.
Hi, nice to see you. I had a question for UNHCR. I was wondering, after your advisory now, are you aware of countries that are currently forcibly returning Afghans? And if so, what have the discussions been like with those questions? And also, sorry if I missed it, but is the UN currently working to try to evacuate people who have worked with it and who feel at risk because of that work? And if so, how are you going about doing that? Thank you.
Shabia, do you want to start, and then I'll answer the second question?
Thanks, Nina, for the question. We issue this advisory particularly in light of discussions by some states about these deportations. So I don't have a list of which countries are, but we're aware that several states actually, in fact, have now suspended these deportations, which we very much welcome. I can give you an indication of some of them. I believe Belgium, Finland, France, Germany, Ireland, Denmark, the Netherlands, Norway, Sweden, and Switzerland. So I don't know if that's exhaustive, but these are some that have now suspended or paused these deportations. So that's good news, and that's what we continue to encourage, and we hope that others will take heed of the guidance too. Thank you.
And Nina, on your second question, what I can say is that there have not been any evacuations so far of UN staff. We are there still in Afghanistan trying to deliver assistance to those who need it as best as we can under the current conditions. We are obviously, however, very preoccupied for the safety of our staff, and we're, in contact with those that we need to be in contact about ensuring that UN premises, UN staff are protected. And as the spokesperson of the Secretary-General said yesterday, regarding national staff, we are extremely grateful for the important work that they have done for the United Nations and its bodies and entities over the numerous years. And it's clear that the Taliban and other authorities have a responsibility to protect and ensure the safety of UN staff, whether they be national or international, and to do whatever they can to ensure their safety. On that, let's take Lisa Schlein. Lisa?
Yes, I'm here. Good morning to you, Rayal, and to all the panelists. You are doing your women's work for all of us on this very difficult situation. First, Shabia, I'd like to ask you, right now people are not moving in any large numbers out of the country, but do you think, are people being blocked from leaving, or do you think that this is a situation which is waiting to explode? And my question to you actually beyond that is whether you are making preparations with the Pakistani and Iranian governments for a possibly large influx of refugees in the country. And then is Tarik around, I hope? Still?
Tarik is there. You have two questions. Can we wait for your third one?
No. That was one large complicated question.
Okay.
For the same person. Is Tarik there? I have a question for Tarik, and then I will not ask my third question after, because you have scolded me. Okay. Tarik, are you concerned that the situation of COVID might actually spread like wildfire? How much work actually can be done, is being done in terms of trying to protect the people? I don't know whether vaccinations are possible or not. And a part of that question on the health issues is Afghanistan and Pakistan are the two countries in the world where polio still remains a live issue. And it's so difficult to eradicate polio because of this. Are you concerned that this is going to be a huge problem, and that somehow or other polio will continue to spread as well? Thank you very much. And please, everyone, James, send us Mr. Ben Messaoud's notes. Thank you.
That'll be done. Shabia, you want to start, and then we'll go to Tarik.
Sure. Thanks, Lisa, for those questions. Maybe the first one about displacement and movements. This has been the situation since the beginning of the year. So these movements have been continuing within the country. So it's really hard to speculate what the situation is in terms of people's intentions, whether they are moving within the country, because that's the only place they can go. But given the fact that since January we've seen internal displacement, and this continues today. I think it more just speaks to the fact that people are going to wherever they can kind of seek safety. And so we just don't have an idea of what's sort of happening at the borders. But in any case, we understand from sources that these numbers are increasing. But as I mentioned, they are still relatively fewer. We will continue to monitor the situation in any case and keep you updated to the extent we can if anything changes or we have more information on that. With regards to anticipating refugee flows, I mean, we have been advocating for sure that anyone seeking protection and fleeing for safety at the borders must remain open, and people must be able to access asylum. And this is a key ask that we continue, an appeal we continue to make. The countries of Iran and Pakistan have really had a decades-long history of providing protection, of hosting Afghan refugees. They host 90% of Afghan refugees worldwide. So we continue to appeal to that long tradition of refugee protection and generosity. But in saying that, if there are refugee movements to those countries, it will definitely require support from the international community to step up, because these countries have been, they host sizable refugee populations. They will then obviously be receiving more arrivals. So that support from the international community has to be ensured. And we are definitely liaising constantly with government counterparts on this evolving situation, and urging not just the regional countries, but the world to ensure a generous support for this crisis.
Thank you, Shabia. Tarik, are you with us?
Yes, thank you very much, Lisa, for those two questions. Let me start with COVID. Obviously, we are concerned. As I have said, the COVID-19 vaccination activities have slowed down, and depending on the security situation, we hope they will resume. Until now, 1,800,000 doses of COVID-19 vaccines have been administered in Pakistan. Pakistan has reported so far over 7,000 deaths from COVID-19. So one issue is COVID-19 vaccination for priority groups, but also within the IDP camps. As I said, those activities have been affected. The second issue, beside vaccination, is public health and social measures. Obviously, as we keep saying at WHO, it's not only vaccines; it's vaccines and all the prevention measures that everyone should take on an individual level, such as physical distancing, mask wearing, avoiding crowds. Obviously, when we have situations where people are on the move, these individual and collective measures are difficult to put in place, and that increases the risk of transmission of COVID-19, but other infectious diseases as well. On polio, our colleague from UNICEF can add as well. I would just say that the encouraging news this year was there was only one case of wild poliovirus in Afghanistan and Pakistan each, so 2 in total, and that was very encouraging. So that shows us that with sustained polio campaigns, we can hope to reach the target, which is eradication. Now, polio campaigns have been done throughout years in Afghanistan, in a conflict situations. It never stopped really. So polio eradication initiative is determined to continue this, because we believe that polio campaigns and health of children is neutral and impartial and should be supported by everyone. Over.
Thanks very much, Tarik. Okay, let's try to conclude this. We'll just give a follow-up question to Catherine, Gabriela. James, did you say you had a follow-up? All right. So Catherine, if you could go ahead with your one follow-up question, and then we'll go to Gabriela, and then we'll close on this issue.
Thank you, Real. I'd like, first of all, I'd like, please, Mr. Mustapha Ben Messaoud, if he could send his contact details to Eunice, and it would be shared so we can contact him directly for interviews. That would be very kind. And my question is to Shabia. Shabia, could you please repeat the countries that you mentioned before, Belgium, Switzerland, Sweden, Germany, maybe I missed one, that organized the move of the people that worked with them. And I have a question to you, Shabia, and maybe to Rupert, regarding Turkey. Turkey has started to build a wall between the border of Iran and Turkey in order to prevent new arrivals. Is UNHCR in contact with Turkey, or is the Human Rights High Commissioner in contact with Turkey? We know that Turkey has already more than 4 million refugees, and that they've been very generous with the Syrian refugees. Is there any discussions with exchanges with the country? Thank you, Shabia. And also, how much can you already articulate figures of money that will be needed by Pakistan and Iran to help all those people to help them arrive in their countries and host them? Thank you.
Thank you, Catherine. Shabia first.
Sure, thank you, Catherine. And maybe just a very, very important clarification about the countries that I mentioned. This was not those countries were not about the evacuations. Those were the countries I mentioned who temporarily suspended deportations to Afghanistan of rejected asylum seekers. So it's very, very important to clarify. And that was in relation to the non-return advisory we issued this morning. So we understand that some countries have announced the suspension of returns to Afghanistan, and those countries, which I can repeat, but just to make sure that that clarification is understood, those were Belgium, Denmark, Finland, France, Germany, Ireland, the Netherlands, Norway, Sweden, and Switzerland. But these are not exhaustive. These are the only ones that I'm aware of. So there may be more beyond that. But this is not about humanitarian evacuations of staff. And then on your question about the appeal, I can get back to you in terms of numbers. I don't know about the regional response because it's so early to say, and we haven't actually seen those refugee flows, these new refugee flows as yet. So, but I can try and get some more information about the humanitarian response in country, which is what we are really in terms of primarily responding to right now, given the needs inside. So I can come back to you on that, Katrine, if that's okay. And then your question on Turkey, I really don't have any information on this. And given, as well as I've been saying, most of the displacement we're seeing from what's happening in Afghanistan is internal, it's really hard for us to speculate. Thank you.
I also am not, I'm not aware of the situation with Turkey. I imagine it would take a very long time to build a wall, but we'll look into that. I would just like to say OHCHR would very much welcomes and supports UNHCR with the non-return advisory and these principles. Afghans who need to flee, who have justifiable fears for their safety, must be able to flee. So we would back UNHCR 100% on that.
Okay, thank you, Rupert. And James Elder, I'm sure you took note of the request of the correspondents to share Mr. Ben Messaoud's contact details. So we have Gabriela Sotomayor, one quick follow-up, and then we'll finish with James and conclude on this topic.
Thank you, Real. I would like to know if there will be an urgent session in the Human Rights Council on Afghanistan. Is there any movement in that direction? Thank you.
I believe it's not decided yet, so I don't think there's been a firm announcement, and that's what I heard late yesterday. So I'll have to wait and see on that.
And James.
Sorry, thank you. I wanted to just come back to Mr. Messaoud, if I could, just to understand. I want to just make sure I'm clear on what you said earlier. The NGO commissioners that you're talking about were actually, there's not one single NGO commissioner for the country, but it's actually in 2 different cities. Is that right? And for the moment, you don't have a point of contact in Kabul for the rest of the country. Can I just confirm that? Thank you.
Thank you. And listen, James, we've asked them this morning actually to maybe change the title of the NGO commissioner. So what is happening right now is that for each area under the control and where humanitarian are working, the appointed point of entry coordinator, an NGO coordinator for those different areas. We're still waiting to have a direct line with whoever will be the interlocutor for humanitarian in Kabul, either at the ministry level or if there would be a system of NGO commissioner or coordinator for Kabul. Thank you.
Great. Thank you so much to all of the spokespeople who've attended this morning to brief on Afghanistan: Rupert, Colville, Shabia, Mantoo, Tarik Jašarević, and James Elder from UNICEF, with guest Mustapha Ben Messaoud, Chief of Field Operations and Emergency, speaking to us from Kabul. Thank you so much, and all the best as you try to operate in these very difficult conditions. Thank you. We hope to hear from you again soon. On this, we will now go back to Tarik from the World Health Organization, who has an update on the Ebola outbreak in Cote d'Ivoire.
Thank you. Thank you, Gael. The press release will follow soon, issued by our regional office for Africa. As you have heard, on Saturday, Cote d'Ivoire declared its first Ebola outbreak in more than 25 years. We are very much concerned about the ability of Ebola virus to spread, because the first case was identified in Abidjan, which has a population of close to 5 million people. Cote d'Ivoire began vaccinating health workers and contacts of contacts yesterday. So in only 48 hours after the outbreak was declared. This was thanks to vaccines that WHO helped to get from Guinea that has experienced Ebola outbreak and had those vaccines available. So the Guinea sent those vaccines to Cote d'Ivoire. So Cote d'Ivoire was able to start vaccination, and that took place yesterday. This swift response is a reminder of how crucial preparedness and surveillance is to minimize the potential damage and to try to limit and stop the spread of the virus by breaking the transmission chain. In fact, Cote d'Ivoire did receive WHO support to beef their Ebola readiness earlier this year, and that helped to have a quick diagnosis of this first case. The case is an 18-year-old woman who traveled from Guinea across land routes on public transport, and we are now in the process of trying to establish contacts, try to see who should benefit from the vaccines. Just to remind you, we have 2 licensed vaccines for emergency use, Merck and Johnson & Johnson. 5,000 vaccines have arrived in country, 3,000 doses of Johnson & Johnson and 2,000 doses of Merck. There are also 7 experts on the ground to support response efforts. So when it comes to numbers, so there was 2 cases, one that has been confirmed. This is the lady that I was talking about, and there's a 1 suspect case. The confirmed case is currently receiving the treatment, as there was also a treatment in terms of monoclonal antibodies that have been provided to the confirmed case. So this is where we are. There are currently 9 contacts identified, and as you remember from our briefings on Ebola, when it comes to Ebola, the ring vaccination is a preferred method. This is basically vaccinating health workers, contacts, and contact with contacts, trying to isolate the virus so it doesn't spread further. Over.
Thank you, Tarik. We have a couple of questions, one from Catherine and the other from Lisa. So Catherine, please go first.
You hear me? Yes. Hi again, Tarik. My question is related to COVID, so I'll wait my turn because I suppose that Lisa and our Bloomberg colleague would like to ask first.
Great. Thank you very much, Catherine. Yes, Lisa and then Corinne from Bloomberg. Lisa, go ahead.
Thank you. Thank you, Catherine. That's nice of you. Tarik, I'm curious, this case that came over from Guinea, Guinea only recently, oh boy, we have a technical problem.
It's okay.
Are you okay, Rael?
Go ahead. Yeah, we're fine.
Take care of yourself. Tarik, you say that this woman came over from Guinea, which recently supposedly eliminated an outbreak of Ebola. Does this indicate that perhaps the outbreak the Ebola outbreak in Guinea had not really been stopped, and that there may be more cases of Ebola in the country that have not been detected or investigated? I mean, is this an area of concern?
It is, Lisa, always, because as you have said, that Guinea experienced Ebola outbreak this year during 4 months. It has been declared over only on June 19th. Now, currently there is no indication that the current case in Cote d'Ivoire is linked to the earlier outbreak in Guinea. Preliminary investigation and genomic sequencing to identify the strain show that there is a close link to the, in fact, 2014 to 2016 outbreak in West Africa. And we are probably looking here at the Zaire strain of the virus as well. Now, further investigations are needed really to confirm these early results.
Thank you, Tarik. Let's go to Corinne Gretler from Bloomberg then.
Hi, thanks for taking my question. I was just wondering, has the genetic sequence data shown what strain it is and where it came from? And then Tarik, you mentioned 9 close contacts have been identified. Can you give an overview as to like whether healthcare workers have been infected or how many of the contacts have been tested, what the test results say? Just kind of an overview would be helpful. Thank you.
Hi, Karina. As I said, so the case has been identified in Institut Pasteur in Abidjan. And again, like a first investigation on sequencing showed that it could be linked to the virus, similar to the virus that has been circulating in 2014, 2016. But this needs further confirmation. What we have really right now is to step up the surveillance. This person has traveled over land during the period of 5 days, while showing the symptoms just at the onset of the travel. So it is really important that we go and try to find people who have been potentially in contact. Make sure that these people are being monitored for 21 days and provided the option to be vaccinated if possible. So as I said, at the latest, what I have is there are 9 contacts. There is 1 suspect case and there is 1 confirmed case.
Thanks, Tarik. Gabriela, is this on Ebola?
Hi, hello. No, it's on COVID.
Okay, we're going to come back to you. Let's go to Agnès Pedrero from AFP.
Oui, bonjour Tarik, c'est Agnès de l'AFP. Une question sur ce qui a été dit sur la Guinée Ebola. Donc, si je comprends bien, il n'y a pas d'indication comme quoi le cas en Côte d'Ivoire serait lié à la récente épidémie en Guinée, mais par contre, il y aurait un lien avec l'épidémie de 2014-2016. Et la question, est-ce que ça veut dire que c'est un lien? Est-ce que ça veut dire que l'épidémie s'est poursuivie de façon silencieuse, ou bien est-ce que ça veut dire que c'est c'est une chauve-souris qui avait ça et puis qui l'a repassé à un être humain.
It is difficult to say really, Agnes, at this stage. So we really need to have further sequencing of the virus, try to see what are the possible hypotheses. But again, at this stage, there is no indication that this outbreak is linked with the one that happened in Guinea earlier this year. But we really need to, before jumping to any conclusions, have further analysis and genomic sequences. Just to remind you, the outbreak has been declared on Saturday, so it's a very short period of time. But we managed in those 48 hours to start the vaccination.
Very good. Okay, so I think those are all the questions on Ebola. So we'll come back to Catherine and Gabriela, who I think had questions on COVID. So Catherine, please, first, and then Gabriela.
Thank you. I will ask my question on COVID, but I will ask kindly to Tarik to repeat his answer in French, please, for radio and TV purposes about le virus d'Ebola lié à l'épidémie de 2014-2016. Tarik, si tu pouvais avoir la gentillesse de répéter ça en français, comme ça on peut l'utiliser pour les médias francophones. And my question related to COVID is regarding vaccination and manufacturing of vaccination. I read an article about South Africa manufacturing Johnson & Johnson Janssen vaccine in South Africa, and that all vaccines are sent outside, abroad, the African continent, meaning other countries. So, I mean, I don't really understand that on the one hand, you have COVAX and in fact saying there's not enough vaccines and that you're trying to give the opportunity to the African continent to have the capacity to manufacture vaccines for the African countries. And on the other hand, you see an African country producing vaccines that are sent outside of the continent to countries that have already people vaccinated. So I would like to have a comment on that. Thank you, Tarik.
Okay, I will. Let me just go first, just to make sure that when I said that, I will say it first in English and I will say it in French later. So the preliminary investigation, when we're looking into the strain of the virus, saying that it's similar to one in 2014, 2016, so and that it's likely Zaire strain. So we are not saying that there is a direct link really, but it is close to the one in 2014, 2016. So we really have to be careful on that. Alors, je vais dire juste en français. Donc, concernant les premières investigations sur la séquence génétique du virus d'Ebola qui a été identifié à Abidjan le samedi dernier. Pour le moment, nous n'avons pas d'indication que cette flambée en Côte d'Ivoire a un lien avec l'épidémie d'Ebola qui a sévi en Guinée plus tôt cette année. Il faut faire d'autres investigations laboratoires et analyser le virus pour savoir s'il y a un lien avec une épidémie précédente quelconque. When it comes to question on COVID, you will have to ask about this particular instance, the manufacturer and the company who is behind that. From WHO, I think we were always clear that there are a number of things that can be done to increase the production of vaccines and availability to vaccines and vaccine equity. And everyone has a role to play. We wanted companies to share their technology with production capacities around the world through technology transfer, through IP waiver, so we can produce more vaccines. Now, these vaccines that are produced obviously should go through COVAX, so we ensure that we try to reach our goal on having 10% of population in each country being vaccinated by end of September and having more people vaccinated in an equitable manner, so we don't have a situation where in some countries we still have health workers and frontline workers who have not been offered the vaccine.
Thank you, Tarik. And then the final question to Gabriela. Gabriela?
Thank you very much, Real. Thank you, Tarik. With the Delta variant and the third wave in Mexico, there are many doubts about infections in children. So I would like to know if globally the cases of infections and deaths in children of COVID have increased. Do you have guidelines for opening schools? Do we have to vaccinate children? Of what age? Those are the questions.
Well, when it comes to children, we are monitoring the situation. We may look into whether there was an increase in a percentage of infected people being children. But what is important is that severe disease and death is still affecting the same category of population as it was before, and that's elderly people and those with the underlying conditions. Now, vaccinating children, first of all, we keep saying vaccination is about preventing disease and death. And because disease and death is occurring in those vulnerable groups, we need to focus on those groups. Vaccinating children would be part of an effort to try to reduce the transmission of the virus from children to elderly. Now, as we know that vaccines do prevent disease and severe forms of disease, but not necessarily prevent the transmissibility or further infections. I think that priority should remain that countries who have extra doses and who have vaccinated their priority groups, that we should really focus on try to save lives and avoid hospitalizations, and that's by vaccinating priority groups in all countries.
Very good. Thank you so much, Tarik, for being with us this morning to brief us on this Ebola outbreak in Cote d'Ivoire, and we'll continue following this situation very closely. That's it for the topics on our agenda. Just to close off this briefing, let me make a couple of announcements. The Conference on Disarmament this morning was meeting to discuss its draft annual report to the General Assembly as submitted by its president, Ambassador Frank Tressler of Chile. The CD will close its annual session on the 10th of September. The Committee on the Elimination of Racial Discrimination will conclude this afternoon at 4 p.m. its review of the report of the Netherlands, which began yesterday. So that's it for today. And the Committee on the Rights of Persons with Disabilities, which opened yesterday, its 25th session, that goes until the 14th of September, will begin tomorrow at 12:30 its review of the report of France. This review will continue next Friday and conclude next Monday, also at 12:30. During this session, the committee will also review the report of Djibouti on the 27th of August and Monday, the 30th of August, as well as Wednesday, the 1st of September, 12:30 each days. There are no press conferences to remind you of for this week, but I think I mentioned on Friday, and I would like to remind you again that this Thursday, the 19th of August, will be World Humanitarian Day. There will, of course, be a ceremony here at the Palais des Nations. This will be at 3 p.m. outside of room 20. So we hope that you can join. Director General Tatiana Valovaya and High Commissioner Michelle Bachelet will be there to give remarks, as well as others who will give testimonials. The ceremony will also be live webcast at webtv.un.org if you cannot be with us in person. That's all that we have for today. thank you so much for joining, and we'll see you again on this Friday. Thank you very much. Have a nice afternoon.